Subscribe to our YouTube channel and press the bell icon to get the latest updates.
I'm at the Guwahati Medical College and Hospital, and with me is the Superintendent of GMCH, Dr. Abhijit Sarma, who was among the first lot of vaccine recipients in the city yesterday. He took his jab and it's been 24 hours. Dr. Sarma, how do you feel?
Nothing. It's just like any other normal day for me. Okay. In fact, after I took the vaccine, I was back to work. In fact, I didn't get time to rest also. There's no 30 minutes resting period, and I had no issues at all.
Okay, that's wonderful. And have you spoken to your other counterparts, fellow doctors? Do they have to say anything?
Yeah, that's what they. I got lots of calls at night, and even in the morning. All my doctors who got injected, they were saying that they didn't feel anything. Nothing happened. There's no adverse. Forget about adverse reactions. There was not even a pain in the vaccinated site.
Okay. And normally when you take a vaccine, what are the adverse effects that you might see?
You might get fever, slightly feverish. Then myalgia. Myalgia is body ache. And then you may feel giddiness. Some people have vomiting, but that's it. These are the minor adverse effects. The rest is rashes can come, urticaria and all that. But that we don't consider as minor adverse reactions. Those are major adverse reactions. Okay. And in this vaccine, we have not seen anything of that sort.
Well, we also know that it is imperative for a vaccine recipient to take a second shot. What I would like to ask is, how long does it take for a person to get fully immune once vaccinated, and how long does it take for antibodies to develop against the virus?
See, I'll tell you, the first dose we have taken yesterday. So after 28 days, we'll take the next dose. Okay. And the immunity, the antibodies to be formed in the T cells will be after 14 days of the second dose. So you are still capable of getting COVID till that time. That's maybe about 45 days.
So it means you still have to be masked and you would, okay?
You definitely for that period of time. In fact, for all period of time, you should be maintaining the universal law. Okay. The wearing the mask, sanitization, and then not overcrowd anywhere. Okay. At least maintain 6 feet distance.
Right. So, Dr. Sarma, in this very hospital, you have had the maximum exposure. You have had COVID patients in the top floors. Many of them had died. You yourself was diagnosed COVID positive. Now, when you look back, what do you think? When you took the first shot yesterday, did you have some thoughts running in your mind that if all this would have happened just a few months ago, there could have been many deaths that might have not happened, or people might have not got infected to that extent?
See, this is a very new virus, so we all were not aware what is going to happen. So getting a new vaccine within 10 months is also remarkable, be it Government of India or any other country. So we have treated more than 10,000 patients here in this hospital. So back of the mind, I'm a human being, right? So back of the mind, when I go and treat these cases in PPE kit, I always think, vaccine. If there is a vaccine which comes, that'll be safe, that'll be better. So with this vaccine which we got yesterday, all of us were elated and delighted to get it.
Wonderful, that's wonderful. On that note, would you also like to make an appeal to people to come forward and take it?
Yeah, definitely. I would say there is some sort of hesitance and reluctance by some quarter of doctors, paramedics. I request them, see, I'm normal, everything is fine. Please come forward, register yourself and get vaccinated.
Thank you so much for speaking to us.